Hey guys, I'm Dr. DeBeer. I'm with Axon Integrative Health, and I'm here to chat a little bit about pain and what is pain and why do we feel this, how does our body process this, and then things that we can do to help get out of pain. So, pain, in short, is danger. So as your brain senses danger, these danger signals are what we interpret as pain, right? So if I stub my toe and I kick the side of the bed in the morning or something like that, and that hurts, that's because I'm getting nociceptive signals or danger signals from my toe sent up to my brain that, hey, something just happened and I need to protect this area, right? So it brings more awareness into the brain. It fires up these attentional pathways and helps us to protect something that might be in danger. When that happens for too long, or we don't do things to heal quite right, or we have a lot of other traumas and stressors along with that, this can develop into chronic pain, where the tissue itself, me stubbing my toe, rolling my ankle, breaking my arm, whatever it is, that tissue is healed. That bone is healed, the tendon's healed, the ligament has healed. However, I still feel pain. And that's because my brain is still sensing danger. And it's not because that tissue or that end joint or muscle is sending signals to the brain anymore. The brain is actually sending signals of danger and pain outward. And this is what we call chronic pain or nociplastic pain. The phenomenon of neuroplasticity, or the ability of our brain to be able to change based on the environment around it and the focus that we give it, can sometimes be bad, right? And that we see this with chronic pain all the time. What fires together, wires together. So if I fire pain signals and these danger signals enough, along with other things like movements or emotions or things like that, they start connecting. And when we have connections of movement or emotions with pain, the next time we move or have that emotion, it will trigger aspects of pain. What fires together, wires together. That's just how the brain works. So when you've had pain for over 3 months and we're not able to reproduce that through a clinical setting or orthopedic evaluations, we determine this chronic pain. We determine this nociplastic pain. Oftentimes, traditional medicine might tell you it's all in your head, which in the way that they're saying it is not necessarily true. You can't think yourself out of this pain, right? But it most certainly is within our head. And I always kind of chuckle with that, right? Everything that we experience as humans is processed by our brain, which means that it all occurs up in the head. Everything in your entire life is in your head. So this notion of trying to discount somebody with chronic pain or pain that we can't see issues with the tissues on imaging or on like MRIs or CTs or x-rays or blood labs or orthopedic evaluations in the clinic, none of those things produce pain, but you still have pain. That doesn't mean you're faking it. That doesn't mean it's all mental and you can think your way out. We just need to address the brain and encourage neuroplasticity to go in the other direction so that we can have wiring and firing together of other things, and we can disassociate pain with movement or disassociate pain with a specific emotion. The brain is just a beautiful thing, and unfortunately pain gets in the way of us doing what we love and usually gets in the way of health overall. One big thing here at Axon is returning patients back to what they love without pain or fear. These are some crucial aspects of life, is to feel like health is the absence of pain. And that's not necessarily it either, right? Pain just helps us show that we are living, right? If acute pain is not a bad thing, right? I don't want anybody to be experiencing chronic pain and not knowing why or not having solutions out. So the biggest thing and the best thing for pain is no longer this ICE protocol or RICE in an acute injury setting, right? We want heat. We want as much blood flow and inflammation as possible to help this tissue heal and regenerate. After a certain amount of time, we need to get back into movement. And moving this thing, even though it might not feel great right now, is necessary. And movement and strength is what builds resiliency, which is what takes us out of and keeps us out of pain. If you're dealing with chronic pain, think about how we're going to change the brain, right? Doing things that modulate neural activity, that like eye movement therapy or vestibular rehab or sensory motor integration or things like transcranial magnetic stimulation or TDCS or transcranial direct current stimulation, things like neurofeedback, things like acupuncture, things like breath work and activity and nutrients and sleep, and all of these things compound and compile into positive changes for chronic pain. If you are dealing with chronic pain and if you feel like all that is locked down, give us a call. We can certainly help and figure out what it is, what the best method is. We see patients from all over the country that travel into Denver to see us for 1 to 3 week intensive periods. If this is of interest to you, please reach out. We can absolutely help you and get you out of pain just like thousands of our other patients. You do not have to live in pain. You do not need to continually be in this danger signaling of your brain. Again, what is pain? Pain is a danger signal in your nervous system. Whether that is in your toe because you just stubbed it, sending danger signals of nociception up to the brain to protect this area and prevent further damage. But pain doesn't equal damage. And we see that with chronic pain, CRPS, phantom limb pain. The danger or the damage of this tissue is no longer present. The tissue is healed or isn't there. And we still have pain because our brain feels that it's danger, and danger equals pain for protection. And I'm going to protect this area until I figure out what's going on. And we help to improve your brain's awareness of your body and allowing those danger signals to not be present anymore, so that your pain can dissipate as well and you can go back to living your healthy, fun